Hi, Dr. Alizadeh with Cosmoplastic Surgery. So we want to take you through all the things you should expect the day after surgery. We're going to talk about positioning. We're going to talk about your breathing exercises. We're going to talk about movement and what's going to really help you to have the best recovery. Also managing your drains, as well as what to think about your dressings and the scars. Okay, so here we go.
Hi, I'm Annika. I'm Dr. Alizadeh's nurse manager here at Cosmoplastic Surgery. I'm going to go over some quick instructions how to get in and out of bed after your surgery. This is demonstrate. This bed here demonstrates a 45-degree angle. You like to have your head of the bed elevated about 45-degree angle. You want to have a pillow available that we're going to be putting under your knees. So it's pretty straightforward to get in bed. When you get into bed, you will always use your legs when you sit down and stand up, almost like a squat. You don't want to use your core at all. Use your muscles in your legs when you're getting into bed. Once you got to sitting position, you're going to gently lay down on your side, and if you have no help, you will use one leg at a time to get up on your side and roll to your back. So make sure that you have your bed pillows under your back for that 45-degree angle, and keep your knees bent when you get in bed. Once you're in bed, you're in pretty good shape. You gotta just get the pillow under your knees. You can use one or two pillows. You want to have no tension on your abdominal incision. So that's the whole purpose of this. You should be pretty comfortable like that, and it should be easy to take your nice deep breaths and relax comfortably in this position. Done. Now I'm going to show you how to get out of the bed. It's basically the reverse of getting into bed. You're going to be removing your pillow under your knees. You're going to gently roll to the side, bring your arms around. You will put down one of your legs gently over the edge of your bed, and at the same time you're going to be pushing up with your arms to get into a sitting position. You're going to keep your elbows nice and close to your body. You're going to scoot to the edge of your bed without using force of your arms. You're going to get out of bed using your leg muscles, not your core. You're going to do it almost like the squat position and get up. You're going to hold your arms tight across your belly, walk slightly hunched over to minimize the pressure on your incision. Now I'm going to demonstrate the breathing exercise that you need to do after surgery. It's extremely important to expand your lungs, to oxygenate the blood and prevent any problems from your lungs in the recovery after surgery. You can use a pillow, and the purpose of this is to splint your muscle, help support your abdominal muscles when you're breathing, to limit any pain or discomfort during this exercise. You will roll the pillow up, you will hug it really tightly, and you will take some really nice deep breaths in where you really can see your chest expanding. Not the shallow breaths, the really deep ones. You're going to do 10 every hour during daytime when you're awake. So you're going to breathe in, hold your breath for a few seconds, and then slowly breathe out. And you got to do that 10 times. If you tend to cough with this, it's okay. Just make sure that you have a really tight grip to splint that muscle. That will limit your pain during this exercise.
Second thing we want to talk about is you have your drain. So this drain is actually sort of sitting, it's snaking in and it's sitting like right here, let's say, and it's coming out. So the segment that's sticking out is right here. So two big things that are the most important. One is you take a little alcohol pad, or you can even wet a little Kleenex, and you grab it at the closest area that you see to the belly. One hand is going to just hold it in place, anchors it. The other one strips. So this is called stripping or milking. Then I move up to this part, anchor one hand, and this one is the stripper, you see? And what I'm doing is clearing the line of all the clots. Again, I'm going to anchor, strip, anchor, strip. And I'm moving all the fluid into the little grenade. This is the container that's going to hold everything. And then at the last step, I want to make sure I open this little thing, count, these are the measurements. You're going to measure everything, record it for us, and then you're going to collapse it, which activates the drain and create the vacuum. You can see it's holding it. This means that it's working. If it's collapsed, it means there's a vacuum that is working. If this is open, you see how it's not collapsed. That means that it's not working. So always activate it, keep it collapsed, and keep stripping with the drain. So that's the drain part. And then last but not least is, what does your dressing look like? Usually there's either a gauze or there may not be a piece of gauze. And then we have a nice clear dressing. I'm going to just demonstrate this on Annika. There's a little dressing that's clear, and that dressing is protecting everything for you. So you can see this shiny stuff. So the nice thing is that if I touch it, you see it's all protected. This can even get wet. So when this gets wet, nothing is going underneath to that. So you may get a little oozing, that's normal. If you have some oozing in here, that's very normal. And then when the time comes, you don't remove it, we will do it. But you see how easily it comes off? It comes right off, right? There's no issues. So that protects your scar. And those are the things to think about after your procedure.
Now I'm going to go over some important post-care instructions. It's important to avoid any non-steroidal anti-inflammatories like Motrins, Aleve, naproxen. They could thin your blood and potentially cause more swelling and bleeding after surgery. If you do have any pain after your surgery, you can take the prescribed pain medication, or you can use extra strength Tylenol. We also want you to avoid multivitamins, vitamins, and some herbs. They can also thin your blood and cause more bruising and swelling. Those herbs are, for example, vitamin E, fish oil, green tea, echinacea. We want you to avoid these things for 10 days before and 10 days after surgery. We recommend that you leave your garments in place and sponge bathe until your first post-op appointment, which is usually at 3 to 5 days after surgery. At that appointment, we'll take your garment off and assess your incision lines.